There are a lot of concerns about Medicare Advantage. Is anybody here on a Medicare Advantage plan? Or some parts of the state it's really big.
Yeah, Medicare.
And Medicare Supplemental. I mean, there are some plans that are Medicare Advantage, which basically the rest of Medicare recipients and taxpayers were subsidizing. And on a Medicare Advantage plan, you got free preventive care, which was important. And so maybe on your Medicare Supplemental, you get free preventive care. But now you're going to get that just through Medicare, so you shouldn't have to buy those extra policies, maybe. Those extra policies also gave free gym memberships, free massage, free, kind of extras. But as I said, a lot of us were subsidizing those special cases. And the insurance companies were making a bundle of money, but now all of a sudden that the government subsidy isn't going to be there for them, is that those plans were subsidized in 2003 by the government. The subsidies were canceled, were supposed to end in 2010. The insurance company said, oh, we just need a little bit of startup money to make these Medicare Advantage plans work. And once we have that, if give us 7 years and we'll make them profitable, we'll make them work, and we can do it better than the government. But now suddenly they're canceling those plans because they're not getting the government subsidy anymore. So a lot of people have heard, oh, the government is going to cancel your Medicare Advantage, the government is going to cancel your, it's not the government canceling, it's the insurance companies deciding they can't make enough money. So a lot of what's in this new law is regulating the insurance companies. And how many people here have had to fight the insurance company for something? Maybe it's just me.
I had to fight for my medicine.
Yeah, because they told you you had to take a certain pill when your doctor said you had to take something else?
No, they wouldn't pay for it.
They wouldn't pay for it.
They put me on different pills all the time.
Yeah.
I'm a diabetic. And every time I went to get them, I couldn't get them over here because they wouldn't pay for it.
They said Medicare won't pay.
Yeah.
Well, I know I had one, my doctor prescribed one medication for me, and she gave me free samples because the pharmaceutical company was trying to sell this new drug.
I got a new one.
So I got a free sample, and then when I went to fill the prescription, they said, no, your insurance won't pay for it.
Yeah, that's what I'm told.
And what it was they wanted me to take a cheaper pill instead of the one that my doctor prescribed. So I went back, I had to get another prescription for the cheaper pill. I took that, it didn't work. And then the doctor had to write a letter saying she really needs this new pill. The old pill doesn't work. In fact, it's making her dizzy, So, in other words, doctors that are supposed to be spending their time taking care of their patients have been forced by these kind of policies to spend a lot of their time on paperwork. Writing letters, writing new prescriptions for drugs they know won't work, and then waiting and the patient calls them back. So it puts everybody to a lot of trouble. Plus, the insurance companies are paying their staff, paying their employees to do junk like this. They're paying employees to reject people, to reject covering people, to reject covering drugs.
And they do not understand, and a lot of them do not understand medicine.
Yeah, exactly. It's civilians, it's not...
No idea what medicine means.
Right. They're not trained doctors, but they're making medical decisions. So what this law does, it's called the Patient Protection and Affordable Care Act is the full name of it. Sometimes we shorten it to affordable care, but patient protection is really a big part of it. So a lot of times the protection we need is from the insurance companies. And this law does a lot to regulate the insurance companies. I don't know if you're aware of this, but a lot of insurance companies only spend about 60 or 70 cents of your premium dollar on actual health care. Like 60 cents, like just a little more than half of what you have put in, as a premium, or what you put in through Medicare as a premium. They're only spending 60% of that on actual health care. The rest of it, where does the rest of it go? It goes to the CEOs making 20, 30, 40 million dollars a year. That's actually just a small part of it, though. A big part of it is, like I said before, rejecting people. They have huge amounts of staff whose main job is just to push paper around and find any excuse they can for rejecting covering things. And I know that when my husband was in the hospital 5 years ago, it really was a full-time job for me. And I was working. I didn't have time to have another full-time job. It was a full-time job for me just to figure out what the medical bills were. It's tremendously easier with Medicare, but it's still not perfect. Because I look at Medicare sends you this thing, maybe you've seen this, it says, if your provider is charging you more than what Medicare says they've paid, that you should pay, then you should get a refund. Well, okay, so I have two piles. I have my big pile from Medicare and the big pile of bills from the hospitals and the doctors, and I gotta compare every single one and see every single time where the hospital or the doctor charged me like $10, $20 more than I was supposed to have to pay for Medicare, and in the end, I should get some of that money back out of them.
But will you ever?
But will I ever? Well, I guess I shouldn't even say that. I haven't even paid the bills yet, so I guess I have to deal with that first because we haven't had the money. I mean, it's amazing. Heart surgery costs, what was it, $260,000 just for the surgery. And luckily, because of Medicare, our bill was only $1,000. But still, only $1,000 is a lot of money for me. It's nothing like $260,000, but I don't know what we would have done without Medicare. We would be dead, but no, for sure. Open heart surgery. Wow. Wow. We could have a contest here. Yeah. Yeah, there is a lot they can do now. There are a lot of miracles of modern medicine, but unfortunately they are expensive. And unfortunately we need to find a way, to contain those costs as well. You had a question?
Why are we taking off Medicare and putting the guys here?
Oh, that I don't know.
Would you check into it, because there's a lot of patients or people here who have been. They've been taken off of Medicare, thrown in the guys who really don't know what it's about.
Huh.
We don't get all the benefits, like the shoes or like nothing. Guys here, but Medicare does. We were taking off Medicare and put our guys here.
Well, would it be okay if I pass this sign-up sheet around and I can email? Is that okay? I have a sign-up sheet here. If you have email address, put it down, or just put your phone number, put your name and phone number, and I'll have your address, obviously, unless you live somewhere besides here. And I'll email you answers to questions as I find them, or I'll relay them to Dave, and he can pass it on. Right, Dave?
Yep.
So, guys, so who made that change for you?
We
Medicare?
don't even know when we were changed.
Oh, here.
Oh, that's
So sign if you want more information, and I'll send it to you.
Did she get it? She can more information.
So before I go on, are there other questions that people have? I will check that. You should be able to choose your plan, as far as I know, but was that under Medicaid or Medicare? Medicare. I thought you got to choose your own Medicare.
Okay, how many of you in here were
Here's
changed?
Harriet.
Okay.
I think Dorothy and Ida. These two. I don't know how many.
They don't have Medicare.
Oh, you know what?
Medicare currently has an open enrollment of about 15 to 20 people
I talked to
on
them.
the drug program.
Oh, is that for the drug program or for
I
everything?
just changed on my
For everything.
Medicare program. I was on CMS, okay? And I got a letter from Medicare saying I became half or less than what I became now. So I called Medicare. They found that they not only found me another drug company that can handle my prescriptions, that will pick up more prescriptions that Medicare wasn't paying for, but I'm also paying half the money I was paying before.
Right.
But what they can't understand, David, is why they were on Medicare. Automatically transferred to God.
Transferred.
And
What
I asked,
Medicare does is Medicare takes people from certain pools, okay? Whether you're a high risk pool, you have a lot of claims, and they'll put you into a different pool where there's less claims to soften what it's costing them to keep you on Medicare. In that case, what I would do, first phone call I would make is Medicare.
Yeah.